this idea that we lock down society for a full year in trying to control the spread of the disease, that is not consistent with how we dealt with any pandemic in the last 100 years. Focus protection is not anything new. So you identify the folks who are at risk, give them tools to reduce and mitigate their risk, consistent with their human rights. That's what you do. That's the lockdown harms are worse than COVID. It's because we're harming our kids, we're harming the poor with the lockdowns in ways that are almost impossible to recover from. Anyone that studies public health understands that public health is a complicated thing. It's a human thing. People are connected to one another. You can't just simply isolate infection control from every other aspect of people's lives. It is an inhuman approach. But humans aren't like that. People are complicated. They need many things, much more than just infection control. They need connection to other people. They need ability to make a living for their family. They need time with one another. They need all kinds of things. And thinking about what those things are should be what public health is about. We basically threw out a generation of knowledge that we had been worked so hard to build up about how to deal with something like this, and we threw it out the window. None of this is normal. And it has great psychological and medical and other kinds of consequences. I still think of this as the biggest public health mistake, these lockdowns is the biggest public health mistake we've ever made. And the harm to people is catastrophic. Poor people who don't have a voice to speak up and complain. I spent my career trying to understand how policies can help or hurt vulnerable people. Every poor person on the face of the earth has been harmed by these lockdowns. I just feel an obligation to speak up for them. It's one thing if this was the only possible policy, then I would have stayed silent, right? But I think there's an alternate policy that will reduce the total amount of harm. The vilification of scientists who disagree with the lockdown ideology has been, unprecedented in my life. I've never, very, very prominent scientists, friends of mine, brilliant scientists, like there's this gentleman, Johnny Anides, who's, if you go back and look, he's probably the most highly cited scientist in the world, actually, even more than most Nobel Prize winners. And yet every time he writes anything, he gets this like cadre of people very unfairly attacking him, maligning him. Other scientists, young scientists have been writing to me, telling me how difficult it is for them to say anything because they're scared that will happen to them. Scientists are human too. And there's been explicit calls for censorship of science by other prominent scientists. Right. You have to conduct science the way it should be conducted, which involves disagreement and discussion and debate. And science decided during this epidemic to stop that. It's like we decided to stop doing science altogether. It's very, very strange.